What kind of isolation we need in COVID-19 infection? It's kind of hybrid of isolation, but it's include contact, droplet, which means that we need to wash hands, of course, gloves, gowns, okay, as long as they are available, eye protection, door closed, no need for negative pressure rooms. Now, one thing you will notice that despite it's not an airborne, we still need the N95 respirator if it's available. If there is shortage, you can use surgical mask as an alternative. Now, we should use only N95 respirator for any procedure with direct exposure to respiratory secretions or droplet to respiratory droplets, like endotracheal intubation, for example, bronchoscopy. With this kind of procedure, you have to use N95 respirator, gloves, gowns, and eye protection. If there is any shortage, we need to be mindful on how to use. We should reserve all these to the person who's really close taking care of the patients. For example, if we have a shortage in gowns, then we can wear the surgical mask and we could see the patient from beyond 6 feet. If we have to examine, then maybe one person can examine that patient just in case of shortages. If the patient needs to leave the room, the patient can wear a surgical mask. But remember, with all procedure that has exposure to respiratory droplets, we have to be careful with N95, gowns, gloves, and eye protection. Remember, our healthcare worker safety is first. So nowadays, also try to reserve as much as you can your surgical mask, and be mindful in using all these equipments, because we don't know if your hospital will soon get multiple cases of COVID-19, or like will be overwhelmed with those, and it will be really important. As I said, there is no need for negative pressure rooms for these COVID-19, but we still use some precaution we use with negative pressure isolation. Hopefully this was useful. Please stay safe. As a healthcare worker, your safety is first. And remember, these guidelines may change and they are always up to date on the CDC website. So please always refer to that, and please refer to your hospital policy as well. Thank you. Thanks for watching this video. Please subscribe to our channel and activate the notification bell so you get to see the videos as soon as they are released. Glad to have you on board.